WHO के एस्टिमेट्स के मुताबिक एयर पोल्यूशन की वजह से हर साल दुनिया भर में लगभग 70 लाख लोगों की प्रीमेच्योर डेथ होती है। Sir, nowadays everyone say that I am sort of breath whenever they climb the stairs. So what is the real reason nowadays young people facing such kind of short breathlessness?
Our exercise that we were doing in the past has come down. Now we all go by car or take metro. We don't walk that much. Is leading to people becoming more breathless.
हमने बहुत आर्टिकल्स में ही पढ़ा है कि जब हमें सांस फूलती है तो हमारा हार्ट बीट भी तेज हो जाता है।
हार्ट के साथ 2-3 चीजें होती है, एक तो चेस्ट पेन।
How much role a pranayam and yoga play when it comes to the recovery of lung?
If patients who have asthma do yoga regularly, their lung function improves, their asthma comes under.
Is there any kind of scientific proven food or nutrition which is there to bring your heart in the healthy mood?
There are a lot of diets which are available. There is a Mediterranean diet which was very popular.
So what is chronic cough? ये कब chronic बन जाता है? कितना dangerous होता है?
So normally cough which can occur because of.
There are two coughs, sir. Dry cough and wet cough. How dangerous it can be for the longer term?
So dry cough is when you have.
क्या आपको पता है WHO के एस्टिमेट्स के मुताबिक एयर पोल्यूशन की वजह से हर साल दुनिया भर में लगभग 70 लाख लोगों की प्रीमेच्योर डेथ होती है। इंडिया में रेस्पिरेटरी डिजीज, ओपीडीज और हॉस्पिटल एडमिशन की सबसे बड़ी वजह बन चुकी है। और सिर्फ एयर पोल्यूशन ही नहीं, स्नोरिंग, स्लीप एपनिया, एस्थमा, क्रोनिक कफ और पुअर स्लीप जैसे इश्यूज भी तेजी से बढ़ रहे हैं, खासकर यंग पॉपुलेशन में। आज हम बात करेंगे लंग्स, पोल्यूशन, अस्थमा, क्रोनिक कफ, स्लीप, स्नोरिंग और स्पेशली कोविड के लॉन्ग टर्म इफेक्ट्स और रेस्पिरेटरी हेल्थ से जुड़े उन सवालों की जो हर एक इंसान जानना चाहता है बेस्ट से। अगर आपको ऐसे ही एक्सपर्ट लेड हेल्थ केयर कॉन्वर्सेशन पसंद आते हैं तो इस चैनल को ज़रूर सब्सक्राइब करें, वीडियो को लाइक करें और बेल आइकन को प्रेस कीजिए। एंड फॉर दिस वेरी इंपॉर्टेंट कॉन्वर्सेशन वी आर जॉइंड बाय डॉक्टर रणदीप गुलेरिया, वन ऑफ इंडियाज मोस्ट रिस्पेक्टेड पल्मोनोलॉजिस्ट, फॉर्मर डायरेक्टर ऑफ एम्स, Chairman, Institute of Internal Medicine and Respiratory and Sleep Medicine, and Director of Medanta Medical School. Thank you so much, sir, for coming and for letting us host you on our Healthy Talk show, which is one of the initiative by MedGate today.
Thank you for inviting me.
Yes, sir. So whenever we hear about lung disease, everyone comes to know about TB. It must be about something respiratory. But out of 100, very less people know what is exactly respiratory medicine. What does a pulmonologist do when it comes to the respiratory health? So I just want you to please let us know and let our audience know what really a pulmonologist and respiratory medicine does.
So you're very right. When respiratory medicine started after India got independence, TB was the major problem.
Yes.
So it is known as TB and chest diseases. But now, because of major advances, we have realized that respiratory diseases have changed in terms of their profile. And tuberculosis is not the commonest respiratory disease that we see. It is an important issue. We are working on TB elimination as far as India is concerned. But respiratory disease is now considered one of the topmost illnesses. If you look at the data from India and global data in terms of the disability adjusted life years and other related mortality, and this is related to two broad areas. One is of course infections. Certain infections are coming, viral infections we see, new infections which cause respiratory problems. We've had COVID pandemic. Before that we had the H1N1, the swine flu pandemic.
Yes.
All of them were respiratory infections. So certain outbreaks of respiratory infections happen. But the important issue is that we are also seeing what we call non-communicable diseases rising. And in India now the burden of disease is more towards NCDs, non-communicable disease.
Yeah.
Among the topmost causes of that is COPD, chronic obstructive pulmonary disease,
Okay.
which is a respiratory disease. Then we have of course a small percentage of people who have asthma. But other diseases which are related to the lungs like interstitial lung disease is becoming more common. Lung cancer is one of the commonest cancers that we see, especially in men. And then of course we have lifestyle related issues Sleep apnea is also one of the issues that we tend to see.
Yeah.
So the whole area of respiratory medicine has changed from tuberculosis to now non-communicable diseases, emerging infections, and also newer methods of diagnosing which were not there in the past, which is known as interventional pulmonology,
Yes.
has also come up in a big way.
So like you said that now non-communicable diseases are spreading so fastly. So as of now in India, which respiratory disease comes on the top and what is the symptom of that disease?
So if you look at non-communicable diseases, the most common non-communicable disease is what is known as chronic obstructive pulmonary disease, which is one of the topmost diseases as far as non-communicable disease is concerned. And this is related to both smoking
Okay.
and also air pollution.
Air pollution.
So when we have smoke which goes into the lungs or polluted which goes into the lungs, it damages the lungs. Gradually our lung capacity starts decreasing. We start developing cough, which is more initially during the winter months. We start developing breathing difficulty, breathlessness. And as the disease progresses, more and more lung gets damaged. Our lung capacity starts coming down. We get breathless on minimal activity. We start having cough, which is with sputum production. There's some wheezing or whistling sound from the chest. And gradually our saturation starts coming down. And people who have advanced COPD become oxygen dependent and they need to take oxygen at home using an oxygen concentrator.
Like you said, you mentioned one word, that is breathlessness. So, sir, breathlessness is always considered for the lung or it can happen due to some stress or anxiety as well?
So breathlessness is a symptom. It can occur because of respiratory causes. It can occur because of cardiac causes. If your heart is not able to pump properly, it can also lead to breathing difficulty. If your lung is not able to get oxygen properly, it can also lead to breathing difficulty. Systemic causes. If your hemoglobin is low,
Okay.
anemia, women have anemia. And if they have anemia, the oxygen carrying capacity of the blood becomes less. So you get breathless because the blood is not able to carry the oxygen to the tissues. And then breathlessness can occur because of certain uncommon diseases like thyroid disorders.
Okay.
But it can also occur because of some psychological problems, like you said, anxiety,
And
panic
stress,
attacks,
yeah.
stress. People can have a feeling of breathlessness.
Okay. So nowadays everyone say that I am sort of breath whenever they climb any mountain or they climb the stairs. So what is the real reason nowadays young people, especially if I talk about, facing such kind of short breathlessness?
Two things have happened. One is our exercise that we were doing in the past has come down. Initially, people would either cycle to work, walk to work. Now we all go by car or metro. We don't walk that much.
Yes.
So exercise has become less. So we're not able to exercise our muscles. Circulation doesn't improve. And the second thing is our lifestyle has changed in terms of our diet. So we are seeing more and more of central obesity. People are becoming more fat. There is less muscle mass and more of fat that is happening. So the combination of these two factors, less exercise, more junk food and gaining weight and having more fat in the body,
Yeah.
is leading to people becoming more breathless on moderate activity like climbing stairs or climbing up a mountain.
Yes. और एक और चीज़ I would like to say, sir, कि obesity and fitness now have hand on hand. People are obese, still they want to get the fitness, but only in gym. They don't want to do the traditional methods like you said, cycling, walking, swimming. Sir, हम लोग हरदम सुनते हैं कि एक सर्टेन लेवल का नॉर्मल ऑक्सीजन लेवल होता है, तो एक हेल्दी बॉडी में ऑक्सीजन लेवल कितना होना चाहिए, और अगर वो ऊपर नीचे हो रहा है तो व्हेन इज द टाइम टू कंसल्ट द पल्मोनोलॉजिस्ट?
सो पहले ऑक्सीजन लेवल लोग इतना नहीं देखते थे क्योंकि दे डिड नॉट हैव ऑक्सीमीटर्स.
यस.
पोस्ट कोविड एवरीवन हैज एन ऑक्सीमीटर बिकॉज कोविड के बाद सब लोग अपनी ऑक्सीजन सैचुरेशन देखने लगे.
बिल्कुल.
Which is very important. Now there are two important components. One is कि breasting कितनी होनी चाहिए, and normally people would say that your saturation should be at least 97% or above at rest. But the other important issue is कि exertion पे कितनी fall करती है.
Okay.
So some people will say that when they're resting it's all right, but when they become active, the saturation dips down to 90 or less than 90. That means your lung reserve is not there, or the reserve of the body is not there, and whenever the body needs more oxygen because of some activity, you're not able to compensate for that.
Yes.
And then that should be evaluated. So if you're exercise, and we have one test which we call 6-minute walk test, कि आप चल के कितना आपकी saturation गिर रही है.
6-minute walk test.
So if you find that on walking your saturation is falling significantly, then it is something that should be evaluated and you should consult your doctor.
Okay. And sir, heart और lung की जो breathlessness होती है उसमें difference क्या होता है? क्योंकि हमने बहुत आर्टिकल्स में ही पढ़ा है कि जब हमें सांस फूलती है तो हमारा हार्ट बीट भी तेज हो जाता है और लंग में भी हमारे ऑक्सीजन रिजर्व जो आपने अभी बात करी, तो इसमें डिफरेंस क्या है?
So कई दफ़ा तो डिफरेंस पता करना मुश्किल होता है, लेकिन हार्ट के साथ 2-3 चीज़ें होती हैं. एक तो चेस्ट पेन, डिस्कम्फर्ट. On exertion, you start getting breathless and you have a feeling of palpitations, retrosternal or chest pain, which can go up to the left arm, shoulder and the left arm. And there can be other non-specific symptoms if you have an underlying heart problem, like blood pressure बढ़ जाता है, things like that. If you have respiratory issues, then most often these symptoms will not be there, but you may have cough, you may have wheezing, that is whistling sound from the chest.
Okay.
Also, people sometimes who have heart-related problem suddenly have in the night, suddenly they get breathless and have to get up in the night because of breathing difficulty.
Okay.
It can occasionally happen in people with asthma also, but that is maybe also a feature of what we call left heart failure.
Okay. In the starting, you mentioned one word, that is pollution. So we have talked a lot about what is the exact amount of oxygen a healthy person should get. If we talk about the pollution, sir, pollution में हमने बहुत सारे words अभी हाल फिलहाल में सुन रहे हैं. That is PM 2.5, PM 10, nitrogen oxide, ozone and multimore. So ये pollutants होते क्या हैं, sir? And how much dangerous these pollutants are for our lungs?
So pollutants are not only dangerous for our lungs, they're also dangerous for the whole body.
Okay.
And when you talk of pollutants, you're right, we have like oxides of nitrogen, oxides of sulfur, sulfur dioxide. Then we have ozone, ground level ozone, which can cause irritation in the lungs and they can lead to worsening of breathing difficulty. It can worsen people who have asthma or COPD.
Yes.
It can lead to more inflammation in the lung. And then we have particulate matter, which is PM.
Yes.
Particulate matter is the size of the particles and microns. So PM10 means the size of particle is 10 microns. PM 2.5 means that the diameter is 2.5 micron, and we have ultrafine particulate matter, which is 0.1 micron. So what does all of this mean? Particulate matter, which is large, gets stuck in the nose and the throat, which is PM10.
Achha.
So it's like if you go to a dust storm and there's a lot of dust, you find your nose is blocked, your throat is bad.
Yes.
Those are large particles which the body is able to trap in your nose and the throat. But PM 2.5 is particulate matter which is very fine. It is 1/100th of a human hair, almost 1/100th of a human hair. So very fine particulate matter. It can travel down into your lungs and it can reach the lowest part of the lung known as the alveoli. It can cause damage to the lungs, inflammation, scarring, and this can lead to breathing difficulty. Like I said, it's a cause which can lead to COPD and long-term lung damage. But also it's important to understand both 2.5 and ultrafine particulate matter can also cross from the lungs into the blood and enter our bloodstream.
Oh.
Then these particulate matters can go to various parts of the body. They can cause swelling of the blood vessels, and therefore they have been linked to heart attacks. They've been linked to strokes. It's been shown that it can also lead to early dementia and other chronic neurological problems. So almost all parts of the body can get affected by the PM 2.5 or the ultrafine particulate matter.
Okay, so PM 2.5 and you can say ultra fine particles, as you said, not only hurt or harm the lungs but also can lead to heart attack and stroke in the future.
Correct.
If I talk about the elders and the children, why it is always said that when it comes to the pollution, these two age groups are the most exposed one? What kind of things can happen to them?
So the extremes of age, children and adults are the most vulnerable population.
Yeah.
Children, of course, because they breathe more rapidly and immunity, of course, is lower in both extremes of age. Therefore, they are more prone to getting more of pollutants in the lung and more changes can happen. Also, the changes in children sometimes can lead to long-term damage because the lungs are still developing.
Yeah.
They are still growing. And therefore, the damage in that lung can have long-term consequences even when they become adults. In the older age group, because your immunity is low, you are more prone to other problems, and most old people, along with aging, have some comorbidities. Some high blood pressure, some may have diabetes, may have some
Lifestyles.
so other things which occur as you grow older. So when you inhale pollution, it causes inflammation in the lungs. It also aggravates the underlying other disease that you have, and because your immunity is low, it predisposes you to quickly catch secondary infections, which can also cause more harm.
Okay. And so we always hear that today's AQI is in so and so. Today's AQI is so high. So, what is the normal AQI a good or healthy environment should have? And when the AQI has gone so risen up or has gone so high, a person should avoid going out.
So AQI is there are different standards. US has a different standards. If you go by the new WHO guidelines which came in 2021, they have brought down the AQI levels, especially PM 2.5, even further because more data suggested that even PM 2.5 of average of what they had initially said was causing harm. So our AQI, which is the one that India follows, a formula formed by IIT Kanpur, is much higher than the global standards.
Okay.
And we're not able to meet that. If you look at the last 10 years data, there are very few days in a year. Majority of days in a year, the AQI is above what is acceptable.
Yes.
It's only during the monsoon months. And it was only for some time during the lockdown that AQI really came to what was acceptable by Indian standards.
Yes.
Therefore, currently one would say that in Indian standards, the lower the AQI, the better it is. If it is more than 200, it is something that one should be careful. Any AQI more than 200, touching 300 or going above, is going to cause problem not only to people who have underlying respiratory or cardiac diseases, but in normal people also.
The healthy one.
Healthy ones who don't have any problem, they will start feeling congestion in the throat, cough, breathing difficulty, wheezing from the chest. And sometimes people who come to work in, let's say, the Indo-Gangetic Plain, Delhi, NCR, central India where pollution level is high, they find that they're not able to work as much because they start getting breathless, they're having repeated episodes of cough.
And nowadays, sir, is it true that living in Delhi or Delhi NCR is dangerous than having multiple smokes in a day?
Yes, so people have tried to look at the degree of exposure that you have, and they've linked that to number of cigarettes that you smoke.
Yes.
And this has also been said by the European Heart Association that living in an area where pollution level is high is as much a risk for heart attack as is high cholesterol or chronic smoking.
Oh.
So this is another risk factor that we are adding to heart attacks and heart diseases.
So pollution exposure can, if the person has the pollution exposure and the lung has got a little bad, so can the lung recover itself after having the exposure?
So there are studies, but they're mainly in children, which they've shown that and they've followed up children in various cohorts. What they've shown is that in children who had exposed to bad pollution or poor quality air, if the air quality improved, their lung function caught up, and gradually over the next few years, their lung function actually improved and they became better. So there is data which suggests that can happen. There is also data which shows that, and this is data from US, where one area there was a lot of pollution happening because of a factory. Because of some strike, the factory shut down. So pollution levels came down. And they also showed that when this happened, the number of people coming to the emergency with breathing difficulty, asthma, COPD, came down also in that period when because of strike, the factory had shut down. So if pollution levels come down, your health related hospital admissions will come down, and in children whose lung function is getting spoiled or coming down, there will be a catch up and the lung function will improve.
Yeah. So what is the recovery time of the smoking? Like if due to the smoke, the lung has got bad, so and the person has quit the smoke. So what is the recovery time to bring the lung into the healthy mode?
So for chronic smokers, there is no, if you have a risk factor to develop COPD, your lung function will decline faster than that of a normal person. So let me put it in a simple way. If our lung function is best, then we are around 25 years of age. Then every year our lung function declines slightly as we age. around 25 to 30 ml per year. But in a smoker who's going to develop COPD, this decline may be 100 ml per year. So now if you stop smoking, then this decline slows down and almost becomes parallel to a normal person.
Yeah.
Earlier you stop, the better it is. If the decline has happened, you've been smoking for 20 years and now you stop, it will recover, but the recovery will not be as good as it was if you had stopped 10 years ago.
Yes.
And would have been better if you had stopped 15 years ago. So the earlier you stop, the better it is for the lung to recover, and more the lung will recover. The later you stop, the lung will recover, but it will not be as good as it was if you had stopped earlier.
Yeah, as we are talking about the recovery period, sir, how much role a pranayam and yoga play when it comes to the recovery of lung?
So we have done studies for this, and we looked at improvement in asthmatic people with yoga, and we had one yoga teacher who used to come from Chhatarpur Mandir, and we were able to show that if patients who have asthma do yoga regularly, their lung function improves, their asthma comes under good control, the requirement of asthma medication comes down significantly. And this is published data. So we have shown not only in patients with asthma, but later on we did it as a part of rehabilitation in COPD patients also, and shown that with regular yoga exercises, your lung function improves, your breathing becomes better, your oxygen requirement becomes less, and even inflammatory markers in the blood become much less. So there is scientific data which suggests that in asthmatics and people with COPD, breathing exercises, yoga exercises does help, but yoga is not only about exercise, it's about a lifestyle modification.
Yes.
So changing your lifestyle in a proper manner, making your lungs healthy, will actually help you in better control of your chronic diseases.
As you are talking about the scientific one, sir, is there any kind of scientific proven food or nutrition which is there to bring your heart in the healthy mood?
So there are a lot of diets which are available. There is a Mediterranean diet which was very popular at some point in time. But generally speaking, a diet which is having good amount of green leafy vegetables, fresh fruits, good minerals. The Mediterranean diet also had fish in them, which was also found to be, fish oil was found to be useful. So diets which are in a day-to-day activity, diets which are more natural, having good green leafy vegetables, fresh fruits, less fat, less synthetic food, are actually good for the body, and they are more balanced. And this is a traditional diet that we used to have before we start having a lot of fast food.
Yes. So nowadays it is very, you can say, trendy on the internet. There's one lung detox water. So everyone is just putting some kind of traditional spices into the water, keeping it overnight and then drinking it. And they are saying that it will detox the lungs. So is it a myth or they're just making a hype?
So I don't think there's evidence or data to suggest that there is something like a lung detox water that is there. It's more of what is there on social media.
Yeah.
And if you really want to prove it, then you must do a good scientific study.
Yes.
Before you can prove it. Otherwise, this is just based on what is put out on social media where there is not much scientific evidence.
Yeah. So we always talk about the outdoor air pollution. We never talk about the indoor air pollution. So if a person is living inside a room 24/7, or I will say like a housewife or someone who stays inside the house, so does these people also have the exposure of pollutants and having the exposure of getting any kind of lung disease in the future?
Yes, so there are two things in this. One is that a lot of times the outdoor air comes inside because of the windows and doors, and so a lot of so when you are having very bad, let's say, outdoor air pollution, you see that during Diwali,
yes,
that you have a lot of smoke inside the house also, although you have not burned crackers in the house. So pollution from outdoor does come to inside, but there is also indoor air pollution, which is coming from inside. India traditionally used to have a lot of indoor air pollution because of use of biomass. So women would cook on chula, using wood, cow dung, dried leaves, and that would lead to a lot of smoke, and they had ventilation was poor in the kitchen. And young girls would get a lot of lung problems, COPD. And it was also seen in children who were playing there if the mother was cooking. And then you also had in certain cold areas where people would, to stay warm, would burn wood in the house, which and in Kashmir, a Gujjar community, it led to a lot of problem in their lung, which is known as Gujjar lung.
Okay.
But now what we're seeing is what is known as air pollution, indoor air pollution, which is the new era or the new generation indoor air pollution, which is happening because of newer chemicals being used in walls and paints.
Yes.
So if you're using a lot of paints in the house, they give out certain substances known as VOCs, volatile organic compounds, which can harm the lungs. And there are certain other structures in the building, construction, which can also lead to pollutants coming inside the lung, coming in the indoor air, causing pollution. So the new generation indoor air pollution is also something which is happening because of construction and paints and other things being used.
Yeah, as you are talking about the new generation, sir, nowadays there is one therapy called scented candle light therapy, where the people are just lighting up the candle with the scent and spraying up the room freshener and having the meditation. So, how much dangerous is that candle and the scent which we are just spreading?
So there is a lot of data regarding in incense that we burn, dhoop agarbatti.
Yes.
There used to be what is known as mosquito coils,
Yes, yes.
which was used to get rid of mosquitoes, and other insecticides which are sprayed. All of them go into the air and they can cause harm. They can lead to worsening of people who have asthma and respiratory problems, and sometimes it can cause cough, throat irritation. So all of these sound very fancy, but they can harm the lung because you inhale all of that and it goes into your lungs and starts causing damage in the lungs.
So how much ventilation is important when it comes to house and office, and especially when everyone is just switching on the AC 24/7?
So you should have some ventilation, cross ventilation, and it's important that at least twice or thrice a day the windows are open and there is good cross ventilation. There has to be some degree of circulation in the room because that is helpful. I know it's difficult to do during summer months when it's very hot outside, but one should try at least in the morning or late in the evening to keep the windows open so that some air from circulation happens. Otherwise, sometimes a lot of indoor pollutants can just stay inside and you're not able to get fresh air coming inside.
Yes. And so everyone nowadays having the air purifier. So is it a marketing gimmick or does it really work?
So there's not much data. If you look at scientific studies, they don't support very much use of air purifiers.
Okay.
For multiple factors, the air purifier's efficacy is not that much. Some of them actually can be harmful because sometimes they may produce indoor substances. Secondly, if the room is big, then the air purifier works only close to where it's worked. It will not work at the other end of the room. And if the room we don't live in a sealed room. So doors are open, windows, air keeps coming, dust also keeps coming. So the efficacy of air purifiers has not been shown to be very much as far as the literature is concerned.
Yeah. And now coming to one disease, or I can say a condition, let me clear it out from you only. So asthma is a disease or is it one kind of condition which can be cured?
So asthma is a very broad term. There are people who have hyperreactive airways, that is children who have asthma-like symptoms, and as they grow older, sometimes they grow out of it, and then sometimes they feel they're all right. So asthma with good lifestyle modification, and some children can grow out of asthma. But if it is hereditary, that someone in the family also had asthma, your parents, grandparents, then you have a tendency. And if there is exposure in the environment to any allergen, then your asthma will stay. You can control it very well, and you can become all right. But to say that you have cured and you will never have asthma may not be correct in that group of patients.
So, sir, you said one term, that is allergy. So, is there a difference between asthma and allergy?
So, asthma is an allergic disorder, but allergies can be nasal allergy, like we call allergic rhinitis, allergic sinusitis. You can have skin allergies, which is urtic area. So, allergies is a broad term. You can have food allergies also. Asthma is one of the allergies which is affecting the lungs.
So can asthma be that much dangerous which can take a life of a person?
So asthma in the past was having some degree of mortality, high mortality in the 60s and 70s for multiple reasons. But now with good medicines available, more awareness, and also better diagnosis, the mortality of asthma has come down significantly. But yes, at times it can be fatal when you have an acute severe attack of asthma and it is not properly treated.
If we talk about the medication, sir, we have always hear about inhalers. So taking inhalers will it make an addictive to that person, or is it a one kind of steroid which is harming the body?
No, inhalers are not addictive, firstly. They are the treatment of choice in asthma and many respiratory diseases for the simple reason that they go directly into the lungs. So if you have to give the same medicine through a tablet, you have to give that in milligram when the inhaler is in microgram, because that tablet goes into your stomach, it goes into the blood, it gets dissolved in the blood and reaches the lung. So much higher dose is required. Also, onset of action is late. It may take 1 hour for its action to start. The inhaler goes directly to the lung, so you need a very slow dose. Its onset of action is immediate, so it is much faster. And therefore, inhaled therapy is very useful for various diseases, asthma, COPD, other diseases also. Whereas tablets the doses are more, so side effects can be more. So inhalers are not only steroids, you can have other inhalers, bronchodilators and others. So inhalers are not steroids. You can have inhalers without steroids also. But the important thing to remember is inhalers are not addictive, rapid acting, less side effects, and are locally acting, therefore they are much better.
Okay. And sir, there is one more term, uncontrolled asthma. So what is it, and does it damage the lung to the severe level?
Yes, so it's very important for asthmatics to understand that they should control their asthma well. Because what happens is when you have bronchial asthma, airways get narrowed, there's inflammation, you start having breathing difficulty, wheezing, coughing. You take a medication, the airways open up and you feel better. But the inflammation in the airways stays, your lungs are still, the lining of the airways are still swollen, and you don't take medication for that. So asthma is not controlled and you're taking repeated medications. Your airways gradually start becoming narrow and the improvement becomes less and less.
Okay.
So you have what we call remodeled asthma. The asthma which was responding to treatment now starts responding less to treatment, and you start behaving like a COPD patient.
Okay.
So that is why asthmatics should understand that it's not only for their relieving their symptoms, is to prevent long-term damage to the lung, and that's why controlling asthma is important, because otherwise it can lead to irreversible changes in the airways which can be more harmful in the long run.
Understood. And so many times people say that if a person has asthma, that person should stop taking milk and curd, any of the cold food. So is it necessary, or it is just a hype which is there in the society?
So I don't think it is necessary. Milk and curd can be taken, especially fresh curd. If you find that taking milk or milk products worsens your symptoms, then obviously that doesn't suit you, should avoid it. And that's true for anything. If you find certain food items don't suit you and you feel that you're allergic to that, you don't need to take them. But there's nothing like this item should never be taken by asthmatics. That is not true.
If you say to the asthmatic people, what 5 cautions they should take?
So one important issue is that you must accept your diagnosis, take your medication regularly and follow your doctor's advice. Then avoid exposure to dust, fume, sudden change of temperature.
Okay.
If there's pollution outside, wear a mask or avoid going it. If there's dust inside, exposure to, like we talked about, indoor factors, avoid all of that. Do some breathing exercise regularly. Like we said, yoga is very useful. So breathing exercises should be done regularly. Take good healthy diet and decrease your stress level, because all of these factors can aggravate asthma.
And sir, how effective a mask PM 2.5, which is so much into the hype, so everyone is just wearing since the time of the COVID. So how much effective is this mask?
So N95 mask is effective against PM 2.5. If you can't wear an N95, a 3-layered surgical mask is also effective. So the masks are useful for 2 points of view. One is from pollution point of view, that if you are going to an area where pollution is very high, they will not allow PM 2.5 to go into the lungs if you wear it properly. And secondly, infection control. If
Yes.
someone has viral infection, could be flu, could be COVID, it will also give you protection.
Yeah. So there is one test that is annual lung function test. So a healthy person should also go and check up this thing when it comes to the lung health.
So lung function test is a simple test that you have to do. You have to blow into a machine and it will see what your lung capacity is and how does it match for your height and your age, and that gives you an idea of how your lung is doing.
Understood.
It's a simple test. It should be done, especially with people who have respiratory problems. They should get it done to follow up how they are doing, and it's part of annual health checkup also in many hospitals.
Okay. Now coming to one of the chronic cough, which everyone talks about. So what is chronic cough, sir? Because we always hear about cough कि खांसी हो रही है, बस हो रही है. ये कब chronic बन जाता है, कितना dangerous होता है, and when a person should start having that symptom कि अब तो भाई डॉक्टर के पास जाना चाहिए because it has been a while.
So normally cough which can occur because of viral infection exposed to cold normally should last less than 2 weeks and you should start feeling all right.
Okay.
Sometimes it can go off up to 6 weeks. But if your cough is persisting and it is with some degree of sputum and it's going on for more than 4 to 6 weeks, you must definitely consult your doctor and get yourself tested. If you have fever and other symptoms, then even earlier you should get yourself tested. But if you have chronic cough which is persisting for more than 4 to 6 weeks, you should get yourself tested because you should rule out any other causes. Sometimes allergies can also lead to persistent cough, and especially people who have an allergic tendency, who are constantly exposed to air pollution, the irritation of the pollutant air will keep on aggravating your cough.
There are two coughs, sir, dry cough and wet cough. What is the difference between these two coughs? And another one, how dangerous it can be for the longer term?
So dry cough is when you have no sputum production.
Okay.
Wet cough is when there is phlegm, sputum, which can be white, it can be yellow, there can be blood in the sputum.
Okay.
So all of that is when you have cough which is wet, which means there is some production of sputum. Dry cough is more of an irritating cough, which can irritate because of irritation of the throat, irritation of the airways or the lung parenchyma. And like I said, if it persists for a longer time, or you have a wet cough in which there is blood or sputum is yellowish in color or yellowish green in color, which may suggest an infection, then you must definitely consult your doctor.
Sir, can acidity, which we call it as GERD, can also cause chronic cough?
Yes, so there are two other important causes. One is GERD, gastroesophageal reflux. If you have acidity and the acidity comes up, irritates your throat and you can have cough. And the other is if you have running nose and you have a post-nasal drip, secretion from the back of your nose can also go into irritate the throat and be a cause of chronic cough.
Okay, understood. And so when this cough can become TB or lung cancer, that symptom a person should know.
So for both of them, like I said, if you have cough with blood in your sputum, it's a warning sign. You should get yourself tested for TB, and sometimes it can be a feature of lung cancer also. Similarly, if you have fever, especially if it's low-grade fever with evening rise, if there's associated weight loss, loss of appetite, and other constitutional symptoms, then you must always get tested because it could be TB. It can also be some symptoms of weight loss, of cancer.
And can antibiotic persist, or you can say less harm the cough, or it can be a good one to take every day?
No, antibiotics. So cough, you must find the cause of cough. Antibiotics is not a treatment for cough.
Okay.
It will depend on what is the cause of cough. If you have a dry cough which is because of allergies, antibiotic will be of no use. If you have a cough which is because of viral infection, antibiotics will be of no use. If you have a cough which is part of acidity or GERD, then antibiotics have no use. Similarly, if it is because of post-nasal drip, antibiotics have no use. So antibiotics should be given only if you have definite evidence that this cough is of infective etiology and the infection is bacterial, for which antibiotics or antibacterial drugs are required.
Yeah. So you have very well explained all the things regarding the chronic cough, regarding the pollution and everything. Now let's go to something more deeper. That is the sleep health, sir. Nowadays, the sleep has become so crucial to everyone's life in the lifestyle, because people are not getting sufficient time of sleep. They are just suffering the browser, scrolling the reels all the night. So sir, nowadays there is one term which is very you can say on the Google, that is sleep apnea. So what is sleep apnea and how does it affect a healthy body and go into the, I will say, a junk body?
So two things. One is sleep. I agree with you that sleep health is very, very important. One of the important factors for our health, along with our diet and exercise, if you need to put another important factor, that is sleep. Good sleep, good quality sleep is very, very important.
Yeah.
Data suggests that we are sleeping less as humans.
Yeah.
30, 40 years ago, we were sleeping 8 hours a day. Now that has come down to almost 6 hours to even 5 hours. And a normal body actually needs minimum of 6 to 7, at least 7 hours of sleep on an average. So we are not getting that much of sleep, and that is affecting our overall health and manifesting as many disorders. Sleep apnea is a disorder which is happening because of lifestyle related problems. One factor being obesity.
Okay.
And what happens in sleep apnea is that we have sleep which is of various stages. We have what is known as light sleep, N1, N2, N3, and then we have REM sleep, which is rapid eye movement sleep.
Okay.
When you are sleeping, what happens in most people who have sleep apnea, they start snoring very loudly.
Yes.
So people feel snoring is a good sign of sleep, but it can be a sign of disease also.
Oh.
So when you are sleeping and you have sleep apnea, your airways your muscles relax while sleeping, and your upper airway, the pharynx muscle here, they just relax and your airways start coming closer and closer. So airways are getting narrowed. And you're breathing through narrowed airways, so you start snoring loudly.
Okay.
Then a time comes when the airways collapse, which is apnea. You stop breathing. You're trying to breathe, there's pressure in your chest, but you're not able to breathe, and your oxygen starts coming down, your carbon dioxide in the blood starts going up, the brain gets stimulated, and you come from deep sleep to light sleep.
Okay.
You don't get up, but your sleep quality becomes bad.
Oh. Okay.
And the brain stimulates these muscles to contract, so they open up the airways, and the person snores very loudly, then stops breathing, then gasps, and then starts snoring again.
Okay.
So this is sleep apnea, but 2 or 3 things happen. One is intermittent. Whenever you have this obstruction, your oxygen comes down in the blood, your CO2 goes up, so it causes harm in the body.
Yes.
You're breathing against a closed airways, so the intrathoracic pressure rises. It causes strain on the heart, and it also affects the sympathetic and parasympathetic nervous system, and it leads to what is known as metabolic syndrome,
Yes.
insulin resistance, fatty liver, heart problems, and can also lead to irregular heartbeat and strokes.
Yes.
So sleep apnea is not a mild disease, it can be a serious disease, and these episodes can happen sometimes 60 to 70 times in an hour.
Oh.
So we have patients when we do a sleep study, the breathing is stopping almost 60 to 70 times or even more per hour, meaning they have severe obstructive sleep apnea.
Yes. So it can happen in like children as well.
It can happen in children as well. We did a study many years ago where we looked at children from schools who were obese and again found that not only was it happening in them, when we did their blood test, these children had high cholesterol level, the sugars were high for their age,
Yes.
and they were having already features of metabolic syndrome at that young age, and therefore it was something that one was concerned, because that means in later life they would develop a lot of non-communicable diseases because of sleep apnea and obesity.
So if I summarize this, sleep apnea can lead to heart attack, stroke, high blood pressure and diabetes as well, because there is resistance of insulin as well. So there is one machine, CPAP. So is it recommended to everyone?
So CPAP is a machine where you first have to do a sleep study and see that you have obstructive sleep apnea. First the diagnosis to be made, then the severity of obstructive sleep apnea. Then you need to see is it severe? If it is severe and you find there is no other correctable cause, sometimes thyroid related disorders can cause it, sometimes you may have a structural problem which can be corrected by surgery, then CPAP is the treatment of choice. It is the machine of choice. But in people who have mild obstructive sleep apnea, sometimes lifestyle modification, weight loss, sleeping on the side, and certain other factors can also help in treating obstructive sleep apnea without having to use a CPAP. But if it is severe or moderate, An ideal treatment would be to use a CPAP device.
So how can sleep apnea can affect the decision making power, memory, and the concentration?
So, because you're not getting good quality sleep during the night, you have what you call fragmented sleep. You feel, when you get up in the morning, you don't feel fresh. You tend to snore off or go off to sleep. You doze off while you're working, and you're not able. Your attention span becomes less.
Oh.
So you're not able to work, or efficacy in work becomes less when you are having obstructive sleep apnea. So people who use CPAP and they feel so fresh in the morning, they feel much better. And many patients will say that they feel their life has changed because now they're getting good quality sleep, and
Yes.
the daytime somnolence or daytime sleepiness totally goes away.
Yeah. And if I talk about in the sleep apnea, what kind of oxygen level should a person have while sleeping?
So, like we said, the oxygen level should not fall significantly. At least the fall should be less than 3 to 4% of saturation. If there is fall in saturation occurs repeatedly less than 4%, then that itself is an indirect sign of sleep apnea, 3 to 4%. Previously we said 4%, now one says 3%.
So people say that coffee pelia, energy drink pelia, now we have compensated the sleep. Is it true or?
No, not at all. Sleep is something you have to have in terms of, like I said, good quality N3 sleep or REM sleep. If you're not getting that good quality sleep by having coffee or tea, you're not going to be able to compensate for that.
And compensation on doing on the weekend, that will also harm the body?
So it will not. So there's nothing like catch-up sleep that you work 5 days and then you sleep the whole day over a weekend. Catch-up, that will also not work. You have to have a good circadian rhythm.
Yes.
So every day the sleep cycle has to be maintained.
Yes. And sir, how dangerous or effective a sleeping pill can be?
So in sleeping pill is a double-edged sword.
Okay.
It can be very harmful if people start taking it when they don't need it, because it's a shortcut that they type people have with it, rather than looking at good sleep hygiene and other factors. But in people who are stressed out for other reasons, sometimes it can be useful to get them to sleep and then gradually wean them off the sleeping pill. So in acute situation it is helpful, but it can be habit forming, and therefore it's best to avoid it and try and look at non-pharmacological methods of trying to improve your sleep and sleep hygiene.
Yeah, my second last question of this podcast to you would be, there is one more thing which is very, very adaptable, or you can say ongoing in the youngsters, that is vaping and the e-cigarettes. How dangerous vaping and e-cigarette can be in respective to the cigarettes, and will it be normalizing in the near future, or it can lead to the respiratory disease like the cigarette does?
So I think this is a very important question, because young generation feel that vaping, e-cigarettes or even hookah for the matter is safe.
Yeah.
But there is a lot of data now of what is known as vaping-induced lung injury, where chronic vaping, because of the particles that are present, even if you feel that this is just harmless, the particles which are present, which you inhale, can start causing injury to the lungs. Some of it can be acute, and there are papers of young people landing up in emergency because of vaping-induced lung injury, and it can have a long-term effect which can be as harmful as smoking. So I would really say that vaping should be avoided. It's not something which is safe, and sometimes it can be habit-forming. It is a new way of trying to get people onto tobacco and tobacco-related products by the smoking industry, which found that because smoking was being banned, they're looking
Let's
for
find another way
of catching people to start using the.
Yes. So my last question to you would be, sir, for today's podcast, is there one myth which you would like to ban forever, which people think about their respiratory health?
Okay, there are a lot of myths that are present. One is that I think it's important to understand that if you do good breathing exercises, you can have healthy lungs. Important to understand that pollution is something that is not only an acute problem, it's a chronic problem also. So don't think that if you are if you go away during winter months and come here and the pollution levels are there, it will not harm you. Pollution is something which is, and we have to work aggressively to decrease the level of air pollution.
Yes. What's the biggest lie you have been told about the air pollution?
The biggest lie that I've been told about air pollution is that Indian lungs are healthy and therefore we have no air pollution doesn't affect our lungs.
Okay. And what's silently killing more Indians than people realize?
I would again say air pollution is causing more deaths than what we realize.
Okay. What's one health advice that even doctors don't follow?
I think doctors become too busy and don't exercise as much as they should.
Yeah. If you can, I have already asked you if you can just ban one thing in India for tomorrow's healthy. And along with this, I would say if you can ban one food for the healthy lung, what it can be.
So if I have to ban something, I would say that we should try and ban air pollution, have good quality
In the
air.
food.
In the food, I think junk food is one thing that we should avoid and start taking more of natural products.
Okay. And one health gadget people trust too much, but that is not the trustworthy thing.
So there are a lot of health gadgets. Some people buy health gadgets which are not that useful, especially the oximeters.
Yes.
And sometimes they give wrong readings. So it's very important to be sure that your health gadget is effective and don't get into panic mode if it is showing low oxygen. It may not be true.
Yeah. And one test everyone above 35 should get.
So I think from the lung point of view, if you have to look at it, one test, there are two actually. If you have any respiratory problem, you must get a lung function done. And if you have cough and other things, a screening chest X-ray should also be done.
Okay, so that's all with Dr. Guleria, and he has explained all the single and basic things about the respiratory diseases, about the respiratory health, and more the sleep health. So in this podcast, we had discussed the sleep health, how we can keep our sleep healthy. Another one, how an asthmatic person can bring the asthma into the cure if he or she can adapt a healthy lifestyle and do yoga,
तो
pranayam, and choose
देना
the
ही
healthy
नहीं है.
food.
अगर आप
Another
स्क्रीन
one is
देंगे तो
how
myopia
important is to maintain the pollution of our environment so that we will not pass the traditional or legacy to the future generation, but also the pollution, and we can control it in the near future only. Thank you so much, sir, for telling
Thank
us
you.
all the things, and it was a wonderful session having the basics and the epics with you in
Thank you very
respect to
much.
the respiratory health.